I'm going to be talking about chronic traumatic brain injury, the changes, challenges, and solutions. That is the long-term consequences of traumatic brain injury, including cognitive, psychological, social, physical, medical, and functional issues. I'll talk a little bit about mortality after TBI and the outcomes of cognitive rehabilitation and long-term rehabilitation programs. And then I'm going to talk a little bit about interventions, including lifestyle interventions that can improve cognition in aging TBI survivors and other rehabilitation programs. So we know that as we get older, there's cognitive decline. That's a normal factor. A certain number of people will develop mild cognitive impairment. 10 to 20% of those with mild cognitive impairment will develop Alzheimer's disease. So there is cognitive decline, but there can also be, because of the long experience that elderly people have, greater wisdom and judgment as well. So some positives. But there's also decline in motor, sensory, medical, sleep issues, and depression can increase, especially in those over 80 years old. So the U.S. Centers for Disease Control and Prevention have just recently declared that moderate to severe traumatic brain injury is a lifelong condition. From the cognitive point of view, we know that there are decreases in attention, speed of processing, verbal learning in particular, but in most areas there's cognitive decline in people with traumatic brain injury over a long term, in this case, 55 to 30-year follow-up in that study. There was another study done that showed the odds of needing assistance on the cognitive FIM increased by 47% per decade post-injury. And even people with mild TBI followed for 30 years on average showed an overall slight decline. But the fact that it looked slight is really a masking of the fact that there's a spectrum of changes over time. Some people improve. In this study, 23% improved, but 55.7% declined. So that's a significant number that we have to be on the alert for when we're treating these patients. And the decline was greater with age, which is what one would expect. There have been a number of studies looking at dementia of the Alzheimer's type in people with traumatic brain injury, and the studies are inconsistent, but a number of them do show that there seems to be a higher incidence of Alzheimer's disease, but others show that there is no difference. However, Parkinsonism, or Parkinson's disease, shows an increased incidence after TBI. That seems to be more clear. And it may be that some of the dementia that people are calling Alzheimer's disease is really a result of the effects of traumatic brain injury and the cognitive changes that take place, added with the aging process. And you combine those two, and you get what may appear to be a dementia similar to Alzheimer's disease. I just want to make a quick note of chronic traumatic encephalopathy and the traumatic encephalopathy syndrome. This is cognitive impairment, behavioral change, and depression caused by repetitive hits, as in American football or rugby, football, European and the normal football. These changes probably do take place. What we know is limited and controversial, and I'm not going to go into that. That's really a whole completely other topic. There are motor changes that take place over a 30-year period in this study. of people with moderate to severe TBI, all of whom had inpatient rehabilitation early after their course. There was spasticity in 19%, contractures in 27%, and the contractures were that one area that tended to worsen in particular as people aged. But there was also a high incidence of chronic pain and joint or muscle pain. And although we think of headaches as being associated with concussion, in this study of people with moderate to severe TBI, 5 years after their injury, the black area on this graph shows those who were having several headaches per week. And in this case, there was more than 35% of patients were still having headaches several times per week 5 years after their injury. Psychological problems are also very common following traumatic brain injury. This study looked at the psychological profiles 5 to 20 years after severe traumatic brain injury. And they found that the scores on the Global Severity Index, a measure of psychological issues, was twice those of people who did not have traumatic brain injury, but were similar in age and gender. And they looked at subscales, and they found that the percentage of scores that were greater than the 95th percentile on these subscales was quite high. One would expect that 5% of people would be, or less, would be greater than 95th percentile on these subscales. And yet we see scores of 51% of people showing increased hostility, 45% showing abnormal depression, 43.8% showing anxiety, and other problems you can see here. And it was found that acceptance of the disability was inversely related to the scores. So the less they accepted their disability, the worse their psychological profiles. There have been a number of studies of depression following traumatic brain injury with long-term follow-up. And a study in the US showed that 3 to 5 years after moderate to severe traumatic brain injury, 7.5 to 17% of patients showed moderate to severe depression. A study in Norway, 10 years after injury, showed 31% had at least mild depression. And a study in Korea showed a higher incidence of depression among people with traumatic brain injury than among a control group, with a mean follow-up of 7 years after their injuries. There's also been found to be a high incidence of substance abuse. In this study, they looked at people with TBI who were 50 years old or older, and 44.8 out of 100 people had problems with substance abuse or dependence on substances. And these were people in the age 50 to 54 group, not in the age that you generally associate with drug abuse. The prevalence of substance use declined as the patients got older. A study in Korea showed that alcohol or drug use disorder was 2.64 times more prevalent for those with TBI than a control group. There are social problems after traumatic brain injury. 5 to 20 years after severe injury, this study showed that 31% of patients had no friends at all. 8% had no support network. And social functioning was inversely related to the psychological index scores. So, in other words, the worse the psychological index scores, the worse the social functioning. but the social functioning was not related to IQ. So it's not the cognitive issues that seem to be important, but it's the psychological, emotional, and behavioral issues that seem to affect social functioning. Here's, depending on how you view marriage, there is some what you might think of as good news in that the number of people married in this Israeli study went from 28% at the time of injury to 64% 5 to 20 years after severe traumatic brain injury. And a study in the United States showed a similar change. People in the age 16 to 19 age group, 11% of those with traumatic brain injury were married. But at age 60 to 69, 62% were married. Employment is a big issue after traumatic brain injury. In this Israeli study done 5 to 20 years after severe injury, 61% of patients were employed, but 39% of them were in sheltered employment or volunteer work. So it wasn't really a true employment. And 73% of the jobs that they had were unskilled. And salary was the main income for only 14% of those patients. Studies in other countries of people with moderate to severe TBI 5 to 10 years after injury showed that in the US, 45% were employed. In Norway, a little over 50% were employed full-time or part-time. And in Australia, about 65% of people were employed. And it may be that the higher incidence of employment in Australia is related to the fact that in Australia, all patients with TBI who have potential were allowed funded work trials and integration aids. So the resources were put into employment, and that seems to have made a difference. If you look at people's function in terms of ADLs and ability to participate in the community, it's found that over time, about 30% of people improve, even between 10 and 15 years after injury, but about 30% of people decline as well. So we have to be alert to the potential for functional decline many years after traumatic brain injury. And mild traumatic brain injury also causes decreases in function. At 1 year post-injury, this study showed 53% of people with mild traumatic brain injury reported functional limitations compared to 38% of those who had had orthopedic injuries. And another study showed at 4 years after injury, a mild TBI group reported worse community participation than healthy controls. And this was in terms of productivity, social relations, and getting out and about. Another study showed that function declines more so in older adults with TBI, which is not surprising. They looked at people greater than 65 years old who were 10 years after moderate to severe TBI and found that they were more likely to decline from earlier years than the younger cohort. 61% declined in walking or wheelchair use, 42% declined in memory after age 65. And 52% of these patients needed part-time supervision, 18% needed full-time supervision. Medical problems are also more common and in the long term after traumatic brain injury. This study of veterans in the United States that looked at those who did not have dementia at baseline, and they found that the incidence of common medical problems was higher in the people who had had TBI than in those who had not had TBI. Incidence of diabetes, hypertension, myocardial infarction, cerebrovascular disease, peripheral vascular disease, chronic pulmonary disease, these were all higher, and renal disease too, all higher than in the control population. And psychiatric problems were also higher. Depression, PTSD, alcohol use, drug use, and even tobacco use were higher. And the risk for obesity seems to go up also. In this study done 38 months on average after traumatic brain injury, compared to pre-injury, overall, there actually was no change, but that was because there were three groups: those whose weight had remained the same, those who had lost weight, 28% had lost weight, but 42% had gained weight over this period of time. And the weight gain was associated with hyperphagia, eating more, and dysexecutive syndrome. That is, problems with executive function, which is not surprising. These are the patients who have trouble controlling themselves, trouble inhibiting themselves, trouble reasoning and following through. Cardiovascular disease is more common years after moderate to severe TBI. In this study, 25 to 35%, there was a 25 to 35% reduction in maximal aerobic capacity 6 to 18 months after injury. Endocrine dysfunction is also quite high many years after TBI. This is 40 months after traumatic brain injury of mixed severity, including some with mild TBI. 31% had at least one pituitary deficiency. Growth hormone deficiency was present in 21%. Seizures are more common even 10 years after injury. 19% of these patients had epilepsy. But if you broke it down into severe and moderate, 33% of those with severe TBI still had epilepsy. And one way to evaluate the medical issues after traumatic brain injury is to look at the causes of death. And the causes of death, certain causes, are much, much higher in people with traumatic brain injury than in the general population. Aspiration pneumonia, more than 48 times as high in people with traumatic brain injury as a cause of death. Pneumonia, other pneumonias, 4 times as high. Suicide was 3 times as high. And even digestive problems were 2.5 times higher. Death from seizures was 22 times higher than in the general population. And this study by Harrison Felix et al. In 2014 showed that on average there was a 9-year decrease in life expectancy of people with moderate to severe TBI. Mortality can be looked at from the time of injury to and how many years are left of life expectancy. So, not surprisingly, the younger people have a greater decrease in life expectancy, about 8 years decrease in life expectancy in this study. Those who were age 79 on average at time of injury had a 2-year decrease in life expectancy. And that's just because they didn't have as many years left to live. Shortening of life expectancy has also been broken down by severity of injury in this study. In this study, people with mild traumatic brain injury essentially found to have no difference in life expectancy. There was another study that showed a slight increase, slight decrease in life expectancy, even in people with mild TBI. But people with moderate TBI had a 4-year decrease in life expectancy, and those with severe TBI had a almost 14-year decrease in life expectancy. So the bad news is that there is decline after traumatic brain injury. The good news is that there are things that can be done to help this situation. And the CDC, the Centers for Disease Control, found that coordinated long-term care can help prevent or reduce many of the costly consequences of traumatic brain injury. There was a study done, a group convened in 2013 to look at chronic traumatic brain injury, and their conclusion was that it was important to get specialty follow-up by rehabilitation physicians and therapists and mental health clinicians, and also to educate the patients and their caregivers. We have to be vigilant for prevention of those areas that are more likely to cause death, like aspiration pneumonia and epilepsy. We have to treat sleep disorders like insomnia and sleep apnea, chronic pain, depression, anxiety, hypertension, hyperlipidemia, diabetes, and hypopituitarism. All of these medical issues have cognitive ramifications, and so do medications that people can be on. So it's very important to try to avoid medications that have cognitive side effects, if it's possible to do so. Drugs like the benzodiazepines and other drugs. And to add pro-cognitive medications like stimulant medications or anticholinesterase inhibitors, if it's indicated. There have been a number of controlled studies of long-term rehabilitation post-inpatient. So these are people who had finished their inpatient rehabilitation and had long-term rehabilitation months to years after injury. And these studies have been done in rehabilitation units, home, day centers, workplaces, outpatient community-based centers, residential programs, and in supported living situations in homes. And gains have been found in these studies in ability or activity, community integration, quality of life, numbers of work hours, improvements in percent living independently, improvements in depression and adjustment. And there have been demonstrated decreased hours of care and decreased cost of care. And the mean length of treatment of these programs is 3 to 27 months. So these are not like the 2-week or 3-week programs that you get after in inpatient rehabilitation shortly after injury. To really affect somebody who has a chronic traumatic brain injury, it takes time. But it's also been shown that all ages can benefit from, in this case, residential rehabilitation. And there have been a number of studies of cognitive rehabilitation months or years after injury that showed improvements in attention, memory, and executive skills. Many of these studies were done more than 1 year after injury. Lifestyle interventions can also help to improve cognitive function after traumatic brain injury and motor function as well. There have not been many studies done with lifestyle interventions in people with traumatic brain injury. So we get most of our information from the healthy elderly population, studies that have been done on healthy elderly, because it's very likely that these studies apply also to people with traumatic brain injury. So there have been studies showing improved cognition or less decline in cognitive function with age, or the delay of dementia, mostly in non-TBI populations, with aerobic exercise. And there was a study done that included patients with TBI that showed exercise improves attention and fatigue, aerobic exercise. These were randomized controlled trials. There's been evidence of improved cognition, less decline or delay of dementia with resistive exercise, including randomized controlled trials, with yoga, Tai Chi, and other mind-body exercises. It's been shown that the number of steps per day in the elderly is associated with improvements in cognition. So the more walking people do, the better their cognitive function. And total exercise hours have been shown to be associated with better cognitive status in the elderly. There have been studies that have shown no cognitive benefit from exercise too. So just to be fair, it's the jury is still out, where it's not 100% clear, but to my way of thinking, there are enough studies showing that there is benefit. But there was a meta-analysis done of randomized controlled trials that showed questionable benefit. And a lot of this had to do with the fact that many of the studies were not well done. Smoking affects cognitive function. So if people stop smoking, it improves cognition. If people get 6 to 8 hours of sleep per night, it improves cognitive function. Enjoyable or challenging mental activity of almost any kind, especially if it involves new learning, can improve cognitive function. There have been some studies of meditation, but this meditation really needs more study with respect to cognitive function. Socialization has been studied. Most of the studies of socialization have been done in combination with other interventions, so it's hard to tell. But there was one study that showed that the availability of a supportive listener was associated with greater cognitive resilience in elderly people, while just getting advice or even love and affection, emotional support, and contact were not associated with it. So it really seemed like a listener, somebody who could just listen to people, was important. There have been many studies looking at diet and cognition, and it is known that if you avoid saturated and trans fats, you can prevent cognitive decline to some degree. Avoidance of red meat is important. Avoidance of sugar, including sweetened soft drinks, has shown to improve cognition in diabetics. And obesity is associated with worsening cognition. Ultra-processed foods are associated with poor cognition, artificially sweetened soft drinks, even excessive coffee intake, greater than 3 cups a day. Just recently, a study was done that showed that this affected cognition. What can we do positively to improve cognition? Well, the Mediterranean diet has been shown to improve cognition and decrease the risk of dementia or Alzheimer's disease. And some studies have looked at the components of the Mediterranean diet, like olive oil. A number of studies have shown that drinking more olive oil improves cognitive status. Eating foods containing vitamin E improves cognition, like seeds, nuts, green leafy vegetables, and eating fruits, legumes, and vegetables is associated with better cognition. Omega-3 fatty acids have been shown to be associated with better cognition, but there have been studies that indicate that just taking omega-3 fatty acid supplements may not help cognitive decline. But if you have the omega-3s in association with just by eating fish or fish oil, this can slow cognitive decline. There's also a diet called the DASH diet, the Dietary Approaches to Stopping Hypertension diet. It's similar to the Mediterranean diet, except that they designate a specific number of servings and they specify a low to moderate salt diet. And that this seems to be associated also with improved cognition. And just looking at just lower sodium intake has been associated with better executive function in adults with cognitive impairment. There's another diet called the MIND diet. It stands for the Mediterranean Intervention for Neurodegenerative Delay. So this is a hybrid of the Mediterranean diets, and it can help to prevent decline in cognitive function and dementia late in life. It is a blend of those two diets, but they also emphasize more berries. And there have been a number of studies of berries, in particular blueberries, with mixed results, but a number of these studies of blueberries have showed positive results, improved cognitive function, eating just daily blueberries, say a half a cup a day. These are randomized controlled trials, and the mixed results were shown in a review of RCTs, but there was a randomized controlled trial just done, showed a couple of years ago, that showed improved word finding and memory in those who used ate blueberries. Diets high in polyphenols help. Diets high in flavonoids seem to be associated also with better cognition. There was a study, the Physicians Health Study 2, looked at beta carotene compared to placebo and showed better cognitive function in men, but it took 18 years before they saw the difference. So we're not sure what to make of this. There have been 2 other studies that showed no benefit of beta carotene up to 7 years of taking the supplements. Regular coffee intake in small quantities seems to slow cognitive decline. So 1 to 3 cups per day was better than 4 cups or more. Tea intake of 2 cups per day showed lower rates of dementia. And many of these interventions that help cognition also help improve medical health and decrease mortality and depression. There was a study also that showed that blue light therapy can help fatigue and daytime sleepiness and depression in people with TBI. We can also, not surprisingly, improve motor function with exercise. So doing resistive exercise in the elderly has shown to improve strength, gait speed, and pain and dysfunction from arthritis. Combined resistive, aerobic, and stretching exercise has been shown to lessen disability in the elderly. Balance can be improved with Tai Chi and other exercises. Yoga has been shown to improve ADLs. Fitness training improves neuromotor function in 2 randomized controlled trials. And not surprisingly, we can improve cardiorespiratory status through aerobic exercise. There are many studies in non-TBI populations showing that you can improve fitness with aerobic exercise, but there have also been some studies in people with traumatic brain injury. So in summary, we do find that there are substantial problems years after traumatic brain injury in cognitive function, physical function, psychosocial areas, functional independence. Caregivers have also been found to be adversely affected by long-term care of people with traumatic brain injury. And medical problems are more prevalent in people with traumatic brain injury with a greater mortality after TBI. But disability and impairment often respond to rehabilitation programs, even many years after traumatic brain injury. But they may take months, it may take months of rehabilitation to make these improvements. And the aging process can be delayed or even reversed to some degree by taking care of medical health problems through exercise, diet, and by learning activities. So thank you very much for listening.